By now, we know that pressure ulcers, also known as pressure injuries or bed sores, are costly to hospitals and painful or even deadly to patients. The international wound care community has widely endorsed the use of 5-layer silicone dressings to prevent pressure ulcers. Knowing that, you have a choice to make. Which pressure ulcer prevention dressings will you choose? Let's look at that question from both a clinical and a cost standpoint. Clinical evidence. Mölnlycke Mepilex border dressings have unmatched clinical evidence. More than 70 evidence pieces support their effectiveness. How many other 5-layer foam dressings have 4 published and peer-reviewed randomized controlled trials demonstrating their effectiveness in pressure ulcer prevention? Exactly 0. But what about costs? Economic evidence. Mepilex Border Sacrum has real-world evidence from the largest ever economic study of dressings. A 6-year observational study showed a $77 reduction in per-patient treatment costs. The average facility saw a reduction of 1 reportable pressure injury per quarter, saving 4 patients per year from serious pressure injury. That adds up to each facility saving between $200,000 and $600,000 in total costs. How many other pressure ulcer prevention dressings can say that? You guessed it, 0 again. Why does it matter? Because each year, more than 2.5 million people in the U.S. develop pressure ulcers, with about 60,000 patients dying as a direct result. For hospitals, this represents a failure, and the cost of failure is high. That cost includes treatment costs, denial of payment, financial penalties, and potential litigation. Your reputation is also at stake. Information on your pressure ulcer rate is readily available through smartphone apps. In one randomized controlled trial, Mepilex Border Sacrum was associated with an 88% reduction in the risk of pressure ulcers. In this ICU department with 1,000 admissions, such a reduction translates to significant cost savings. Some pressure ulcer dressing companies may promise you big savings on the cost of dressings themselves, but the savings will quickly disappear if you have to treat even a single serious pressure ulcer. When you select Mepilex Border Sacrum or heel dressings with deep defense technology, you're choosing products with the most scientifically and clinically proven effectiveness, reducing pressure ulcer incidence by up to 88%. And that's a relief not only to your bottom line, but to the millions of patients who suffer from bed sores every year. Don't just take our word for it. See the proof for yourself.